Hello, I'm Dr. Ermelinda Bonaccio, Clinical Chief of Breast Imaging at Roswell Park Cancer Institute. Breast cancer screening is one of the most important things a woman can do for her health. Having a screening mammogram every year lowers the risk of dying from breast cancer 30 to 50%. Despite the importance of screening mammography, many women still have questions about when it is right for them to have a mammogram. Today, we hope to answer some of those questions. We recommend that women at average risk for breast cancer begin having a mammogram at age 40 and then have one every year after that. Women who are at higher risk for breast cancer due to a strong family history of breast cancer or prior history of a breast biopsy showing atypia might begin screening mammography at an earlier age, but this should be done only after consultation with your physician. Yes, if you have implants, you can and should get a screening mammogram every year. The recommendations are the same. The mammogram is a little bit different for women with a breast implant. We will take one set of views where we can see the implant and one set of views where the technologist displaces the implant back and we only image your breast tissue in front of the implant. We do not recommend a woman have a routine screening mammogram while she is pregnant, even if she's over the age of 40. Occasionally, if a woman feels a lump while they're pregnant and we aren't sure of the cause of that lump with just an ultrasound, we may do a tailored mammogram with limited views, but this is not a routine test we perform during pregnancy. A woman can have a mammogram when they're breastfeeding, and this doesn't affect your ability to breastfeed the baby later on in the day. However, breastfeeding does increase a woman's breast density, and this can limit the sensitivity of the mammogram. Therefore, if you plan on stopping breastfeeding within a few months of the time you're due for a mammogram, we usually ask for patients to wait for after they've stopped breastfeeding so that the mammogram is more sensitive to finding cancers. Yes, you can get a mammogram if you have your period. It doesn't affect the sensitivity of the mammogram. Sometimes a woman's breasts are more tender while they have their period, so if that is the case for you, you may want to schedule it at a different time, but you can certainly have a mammogram while you have your period. Women used to be told that they could not wear deodorant the day of their mammogram. There was a concern that it would interfere with the mammogram because sometimes we can actually see the deodorant on the images. This is not the case. We can definitely tell deodorant from any finding in the breast, so we encourage women to go ahead and wear deodorant the day of their mammogram. Yes, you can have caffeine before your mammogram. It used to be thought that caffeine increased fibrocystic changes in women's breasts and therefore made their breasts more tender and possibly even more dense for their mammogram. This really hasn't held up to be true. So we don't ask women to stop caffeine before their mammogram. If for some reason caffeine does increase breast tenderness for you as an individual, then you can stop, but it's certainly not necessary to stop caffeine use.